The epigastric port is given now. The port on the left side at the lateral border of rectus abdominis, somewhat towards the umbilicus, around 2 feet distance from epigastric port. The fourth port is on the right side at the level of umbilicus in the lumbar region. Clean কর দুই পাশে. See, this is the reverse sulcus, and here is the lymph node. Lymph node is here, so we will be starting our dissection. Coagulation above the lymph node on the gallbladder wall, on coagulating the visible vessels. Those are the branches of cystic artery arising from the undersurface of the lymph node. The cystic artery is somewhere here. Main cystic artery from right hepatic artery goes to the undersurface of the lymph node, divides into several branches, goes on the gallbladder wall. And these are minor vessels. We are just coagulating the fibrous and fatty tissue on the posterior aspect also. We will try to keep our dissection above the reverse sulcus. This is the reverse sulcus, so if we keep dissection above the reverse sulcus, it is likely to avoid the common duct. And if we keep above the lymph node, it will avoid the common hepatic duct. The reverse sulcus guides us above the common bile duct. Now, this is the lymph node. We will divide the vessel on the gallbladder wall here. We are using ligature. You see, vessel is divided. The divided end of the divided vessel. And just dissecting. The lymph node along with the divided vessel is falling medially. Here. Now this side I think it is clear. This side also clear. So we can now ligate the cystic two places, and then this is somewhere here is the common duct. We will just, I think nothing is necessary. The বেশি টান না, just ধরে রাখো. We do not want to pull much. In that case, it can cause Y effect, catching the. Our suture is a bit longer. I think that is not a good thing. It is my fault. No problem. আহা, তুমি আমাকে কাজ করতে দাও. I think it is okay, not necessary. আলোকের গাড়ি আছে না? আচ্ছা, পড়াশোনা আসলে তোমার সাথে চলে যাবো আমি. বলো. ঠিক আছে, বন্ধ রাখো. So it is somewhat inflamed, and we need to be careful not to injure the liver, and if possible not to perforate the gallbladder. 2 centimeters away from the insertion of that, due to our pool, there is no bleeding from the liver surface. ছাড়ো একটু। ধরা দরকার নেই। Using the 5 mm telescope through the left-sided port for visualization,